So heartworm disease is contracted by the bite of one infected mosquito. Usually what happens is the mosquito will bite a coyote or a fox or something and will get the disease, and then the mosquito can go from there and bite a dog and infect the dog. Heartworm disease can be found in many different small animals. The most common reservoir are coyotes and foxes, but we are really concerned about disease being transmitted to dogs and cats, although in felines it's usually much less common than in dogs, but it's a big concern in dogs. After the mosquito bites your dog, it's going to take 7 to 9 months for the adult heartworm to show up and for the test to become positive. The main sign once you have a case of heartworm disease, if they are showing clinical signs, would be coughing. They can lose weight, they can show fatigue, and eventually you can get heart failure, further down the line. It's critically important that you keep your dog on preventative. Even if your dog is bitten by a mosquito that does carry the disease, your dog isn't going to get it. And the companies will stand behind their products if you buy the products through your veterinarian. If you buy your products online, then the companies won't support their products. So it's very important to test every year to make sure that you're negative. And then going on preventative is, we have monthly preventatives, and there's also new injectable preventatives. At this animal hospital, we're not using the injectable. We find the orals to be a bit safer, but it's a once a month, either chewable or topical application. At 99-point-something% prevents heartworm disease. So there's a couple different options. The primary treatment that we use is a combination of an antibiotic, doxycycline, and a product called imidacide. Imidacide is like a poison for the heartworm. Your dog has to be cage rested for 4 to 6 weeks during this time, because we worry that if they're too active, the worms will die too quickly and they could have an anaphylactic reaction. So it's very important that during the imidacide treatment, usually the imidacide is given in a 3-shot sequence. You do one, then you wait a month, and then you do 2 more shots separated 24 hours apart. So it's a pretty big time frame that your dog has to remain at cage rest, like leash walks only, no running, no jumping, no playing, for 4 to 6 weeks. In cases where animals that we don't think can handle that, or they have a low worm burden, we could also consider doing a slow kill, which would consist of doing a product called Advantage Multi, which is a topical. But that can take 2 years to clear the heartworm disease, which is a long time. Yeah, so the product that we place them on is only 99% effective. There's still that 1%, and you always want to check to make sure, because knowledge is power, and the sooner you know and the sooner you treat, the easier it is on your dog.